What do Bollywood star Poonam Pandey from India and Argentina's Eva Perón, famous women's rights hero, have in common? The answer? Cervical cancer. It killed Eva Perón, better known as Evita, and Poonam Pandey recently faked her own cancer death, trying to bring more social awareness to cervical cancer. And she's still living with it at age 32. Hi, I'm Dr. Brian. I'm a doctor and I train at Michigan and Dartmouth. In today's video, I'm going to do a deep dive into the sobering reality of cervical cancer. I'm going to examine, why is cervical cancer so important? What is cervical cancer? What causes cervical cancer? And most importantly, how can it be easily prevented, and what you can do for yourself and your loved ones. So worldwide, cervical cancer is the fourth most common cancer among females, and there's approximately 600,000 cases of invasive cervical cancer diagnosed each year, and over 300,000 cervical cancer deaths each year. Now, cancer of the cervix is the third most common cancer of the female organs and the third most common cause of death in the United States among female type cancers. But in Africa, Central America, cervical cancer is the leading cause of cancer-related deaths among females. And in India, it's either first or second for causes of death in females. Now, the cervix is the bottom part of the uterus. The cervix opens up into the vagina or the birth canal. And the cervix is composed of two main types of cells. The outer layer of the cervix is covered with cells called squamous cells. And cancer of this area is, in medical terms, called squamous cell carcinoma of the cervix. The cervix also has an inner portion that is glandular. And this is made of cells that form glands. It's the inner lining and it leads up into the uterus. These also can become cancerous. This is known in medical terms as adenocarcinoma of the cervix. Both of the cells lead to cancer and both need treated. Now, out of all the different cancers, the causes of many of them really are not well known. Pancreatic cancer, for example, we really don't know what it causes it. But cervical cancer is not a mystery because 99.7% of all cervical cancers are from infection. That's right, an infection. And spoiler alert, if you are or you have been sexually active, you have it. Not cervical cancer, but the infection, HPV or human papillomavirus. Worldwide, it's by far the most common sexually transmitted infection. Again, virtually every single individual that has been or is sexually active has been or is infected with HPV. HPV is a DNA virus, and that means it has a little bit of genetic material in it. It's spread from person to person by unprotected sexual activity. This means anal, vaginal, oral, and HPV is unusual in viruses in that it causes contact infections. This means that the virus stays in the cells near the point where the infection occurred. It doesn't spread throughout the whole body. Think of HIV or hepatitis. It gets into your blood system. It goes everywhere. But HPV, since it's spread through sexual activity, this means that the HPV virus stays where it started, right near the cells. This is in the vagina, the vulva, which is the outer layer like the labia of the vagina, the anus, the penis, in the mouth, and the throat. Now, there are over 100 types of HPV, and the vast majority don't cause any problems, but there is irrefutable evidence that shows that HPV causes cervical cancer. And out of these 100 varieties of HPV, about 15 of them are bad actors. They cause the cervical cancer. Evidence linking HPV to cervical cancer is extensive, and approximately 15 of the 100 subtypes are known to cause it. Now, HPV subtype 16 accounts for approximately 50% of cases. HPV 18 accounts for about 20% of cervical cancer. And then there's a scattering of different types. HPV 31, 33, 45, 52, and 58 together are estimated to cause an additional 20% of cervical cancer. Now, in addition, although it's beyond the scope of this video, not only does HPV or human papillomavirus cause 99.7% of cervical cancers, HPV type 16 and 18 also cause nearly 90% of anal cancers and about 70% of oropharyngeal cancers. That's cancer that's in the mouth and in the back of the throat. And these numbers are for the United States. Now, most people who are infected with HPV have no signs or symptoms. And in most cases, they never develop any problems caused by HPV. But in 10 to 20% of females, the HPV infection doesn't go away. And in this chance, with those viral particles sitting in the cells, there's a much greater chance of developing cervical precancer and then cancer. And it usually takes on average 20 to 25 years for a new HPV infection to cause cervical cancer. And typically, because of this very slow development over several years, the cancer oftentimes doesn't cause symptoms. Now, it can cause abnormal vaginal bleeding or an unusual discharge, but close to 50% of patients who are identified with cervical cancer by the time they get diagnosed have spread from the cancer outside of the cervix to other portions of the body. Now that's the bad news, but there is some good news. With regular screening, the abnormal cells in the cervix can be identified before they develop into cancer. For example, women over 21 should undergo a regular pap smear. This is where a sample of tissue is gently scraped from the lining of the cervix and looked at underneath a microscope to test for abnormal cells. Now, a positive test doesn't mean that you have cancer or cervical cancer, but rather these real irregular cells in the cervix are a marker for cells that may develop into cancer in the future. So then patients can either be monitored more closely with more frequent pap smears, or for more severe irregularities, one can undergo a procedure called a colposcopy. This involves a physician examining the cervix through a microscope and possibly taking small biopsies of tissue for closer examination, and in some cases, the affected tissue may even be locally removed. Now, the real game changer for cervical cancer protection and prevention is vaccination. Yes, just like measles, mumps, and chickenpox, there is an effective and safe vaccination for cervical cancer. And currently, there are 3 safe, effective vaccines available. And these especially target the bad actors HPV-16 and HPV-18. Which vaccine is available depends on which country you live in. In the United States, there is Gardasil 9. This is the vaccination that vaccinates for HPV-16, 18, and then 7 more of the risky subtypes. The vaccine comes in either 2 or 3 doses a few months apart, and whether you get 2 or 3 doses depends on the age. Right now, the HPV vaccine is standard care for males and females aged 11 to 12, and it can be taken as early as age 9 and all the way up to age 45 in certain situations. And remember, for males, because it will prevent anal, penile, and throat cancer, it's also highly recommended. So the good news is the vaccine, but the great news is that there is good evidence that suggests that vaccination of women and men can reduce the worldwide incidence of cervical cancer by almost 90%. And there is sophisticated mathematical modeling that estimates over 62 million cervical cancer deaths can be averted by 2120 with appropriate screening and aggressive vaccinations. That's cervical cancer. Thanks for watching, and please don't forget to hit subscribe.